Hi guys, welcome to Photizomed YouTube channel. So today we're talking about how you go about your anatomy Viva or Steeplechase exam. So anatomy Viva or Steeplechase exam is actually a very quick exam that is required to answer questions on that's like seeing a physical bone or muscle. So that's gross anatomy. So you have to answer it within like 30 seconds. So yeah, then sometimes the questions can be identify the structure or any structure that is related to the parts painted or pinned. So here you have the clavicle. So once you see the structure, one of the things you need to do is to identify your superior surface, your inferior surface, your medial aspect, lateral aspect, your anterior aspect, your posterior aspect. So those are some of the things you need to take note of. So in the case of clavicle, how do you identify your superior aspect? The superior aspect is smooth, while the inferior aspect is rough. So the medial end, which is the sternal end, is enlarged and is triangular, while the acromial end is flattened and it articulates with the acromion. So you can have the superior surface painted that okay, what part of the structure is this? So once you know that it's smooth, you know that that's what the superior surface of the clavicle. You can just be given the clavicle and you'll be told to identify okay, what structure is this? So you should be able to tell whether it's right or left clavicle. The way you'll be able to tell is through the you being able to identify your anterior, posterior, medial and lateral, then superior and inferior surface. That's the way you'll be able to tell. So the clavicle, the image of the clavicle here is the right clavicle. The right clavicle. Remember, it is what convex anteriorly on the medial tutor and concave anteriorly on the lateral one third. So you can see the trapezoid line. So once you see there's any roughness on that particular surface, you know that's the inferior surface of the what of the clavicle. Once you see that it is smooth, you know that that's the superior surface of the what of the clavicle. So the acromial end can be painted, and you can be asked what is the part painted. So you say is the acromial end of the clavicle. You can be asked what structure is related to the part painted. So you know that that's the acromion. The acromion is related to the what acromial end of the clavicle. Is the acromion that articulates with the acromial end of the clavicle. For the sternal end, you can be asked what structure relates to the sternal end of the clavicle. You know it's the sternum. So you can be asked what is the part painted or what structure relates to that part. So for the inferior surface also, the groove for subclavian muscle, you can be asked, okay, what is the part painted? You can paint that groove. So you can be asked a question on that, okay, what structure relates to that groove? So you write subclavius muscle. The conoid tubercle can also be painted, so you should be able to identify that okay, that's the conoid tubercle. And you can be asked what structure relates to the conoid tubercle, that's the conoid ligament. The trapezoid line can likewise be painted, and you can be asked what structure relates to the trapezoid line, to the parts painted. You know that that's trapezoid ligament. Trapezoid ligament. So here you have the image of the left clavicle. So remember the acromial end, which is the lateral end of the clavicle, is flattened and the sternal end is enlarged and is triangular in shape. The superior surface is rough, the inferior surface is what? The superior surface is smooth, the inferior surface is rough. So you can see the inferior surface here is rough, and then you can see the superior surface is smooth. So here you have another image of the clavicle. So you can see the superior surface of the clavicle is smooth, the inferior surface is rough. You can see the part labeled 5, that's the conoid ligaments. So you can pause the video and try to identify each of these parts. So what clavicle is this? This is the left clavicle. And then this is the what clavicle is this? This is the right clavicle. I hope you're able to identify it. So here you have another clavicle. Is this the right or left clavicle? So this is the right clavicle. So what clavicle is this? Is this the right or left clavicle? So this is the right clavicle. So how do you know that this is the inferior surface of the clavicle? You can see this the depression towards the mid part of the clavicle. So that's the That's the groove for subclavius muscle, and you can see the sternal end that is enlarged. So on this inferior part, and then you can see the acromial end that is flattened. So and remember, it is convex anteriorly on the medial to third. So that's this larger portion, this inferior part, this larger portion is the medial part of it that is convex anteriorly. So once you use your imagination to like reposition it, you see that it is what? It is the right clavicle. So here you have the image of the scapula and the humerus. So you can be asked, okay, what part is attached to the part painted? So let's identify the different parts of the scapula, the different parts of the scapula. Okay, let's start with the borders. So A is the superior border. The part labeled A is the superior border. The part labeled B is the medial border, and it's for the attachment of what muscle? Of the rhomboid major, the rhomboid minor muscle. That's towards the superior aspect. That's on the um that's on the superior aspect above the spine, the spinous process. So above the spinous process, that's where you have the rhomboid major and minor, and then at that part where it is labeled D, that superior angle part, that's where you have the levator scapulae attaching to the scapula. So D is the superior angle, and E is the inferior angle, F is the lateral angle, of the scapula. So the part labeled 1 is the acromion. So you can be asked what structure relates to the acromion. So you have the deltoid muscle attaching to the acromion, you have the clavicle articulating with the acromion, that's the acromion end of the clavicle articulating with the acromion, and the part labeled 2 is the coracoid process. There are three major muscles that attaches to the coracoid process. You have the pectoralis minor, the coracobrachialis, and the short head of bicep brachii. The part labeled 3 is the scapular notch, and the part labeled 5 is the infraglenoid tubercle. That's for the attachment of the long head of tricep brachii. The long head of tricep brachii. The part labeled 5 is the what? Infraglenoid tubercle. So take note of that. So you can be asked what is the part painted, and you can be asked what structure relates to the part painted. So first of all, take note your superior, your inferior, your medial, your lateral, then your anterior, and then posterior. Your anterior and posterior. So the part labeled 8 is the infraspinous fossa. The part labeled 8 is the infraspinous fossa, and it's for the attachment of the infraspinatus muscle. The part labeled 6 is the supraspinous fossa, and it's for the attachment of the supraspinatus muscle. The part labeled 12 is the subscapular fossa, and it's for the attachment of the subscapularis muscle. So take note of the part, the name of the part, and what structure relates to it. So read your question well, know whether they're asking you to identify the part or they're asking you to name the structure that is related to that part of the bone. So here you have the lateral view of the right scapula. So the part labeled 1 is what is the acromion. So the part labeled 1 is the acromion, and then the part labeled 7 is the spine of the scapula, and then the part labeled 4 is the glenoid cavity, or you can say the glenoid fossa. The part labeled 11 is the supraglenoid tubercle, and that's the site of attachment for the long head of bicep brachii. The part labeled 2, as I mentioned earlier, is the coracoid process. The coracoid process. And the part labeled C is the lateral border. There are two major muscles that attaches to the lateral border. That's the teres minor muscle and the teres major muscle. Teres minor muscle and the teres major muscle. The spine of the scapula can be painted. That's the part labeled 8. The part labeled 7, can be can be painted, and you can be told to mention structures that are related to it. So the deltoid muscle attaches to the spine of the scapula, and also the trapezius muscle attaches to the spine of the scapula. So moving to the humerus. So first of all, you identify your superior border. That's the proximal aspect of the humerus, and then you identify your inferior border, that's the distal aspect of the humerus, and then you identify your medial and lateral. So that's the point, the part the head of the humerus is pointing to is the medial border, the part the greater tubercle is pointing to is the lateral border. So the part labeled 1 is the greater tubercle of the humerus, and the part labeled 2 is the lesser tubercle of the humerus. So you should be able to mention the structures that are related to this part. So like the greater tubercle, the supraspinatus muscle, the infraspinatus muscle, and the teres minor muscle attaches to the greater tubercle, and for the lesser tubercle, the subscapularis muscle attaches to it. The subscapularis muscle attaches to the lesser tubercle. So the part labeled 3 is the crest of the lesser tubercle. The part labeled 3 is the crest of the lesser tubercle. So you should be able to tell the difference between 2 and 3. 2 is the greater tubercle, 3 is the crest of the lesser tubercle, while 4 is the crest of the greater tubercle, the crest of the greater tubercle. So 5 is the intertubercular sulcus or groove, intertubercular sulcus or groove. So the structure related to the part labeled 5 is the long head of bicep brachii, the long head of bicep brachii. That's the tendon running through it to attach to the supraglenoid tubercle. So the part labeled 7 is the deltoid tuberosity and is for the attachment of the deltoid muscle. The deltoid muscle attaches to the part labeled 7. So moving distally, the part labeled 9 is a lateral supracondylary ridge. So remember, any structure on the side of the greater tubercle is what is on the lateral side, and any structure on the side of the head of the humerus is on the medial side. So the part labeled 14 is the anatomical neck, and the part labeled 6 is the surgical neck. So moving to the distal aspect. At the distal aspect, you have the coronoid fossa and the radial fossa. The part labeled 10 is the radial fossa that articulates with the head of the radius, and the part labeled 17 is the part labeled 17 is coronoid fossa for the articulation of the coronoid process from the ulna, while the part labeled 10 is the radial fossa for the articulation of the radial head or the head of the radius. So the part labeled 12 is the capitulum that articulates with the head of the radius, and the part labeled 19 is the trochlea that articulates with the trochlear notch of the ulna. So if you look at the image in the middle that shows the medial aspect of the humerus, so you see the part labeled 18, that is the medial epicondyle. And can be asked what structure relates to the medial epicondyle. That's the what common flexor tendon. The common flexor tendon originates from the medial epicondyle, while the lateral epicondyle, that's the part labeled 11, is for the attachment of the common extensor tendon. Common extensor tendon. The part labeled 16 is the medial supracondylar ridge, the medial supracondylar ridge, and the part labeled 19 is the trochlea, The part labeled 19 is the trochlea. The part labeled 21, which is on the medial aspect, is the groove for ulnar nerve. We can call it ulnar groove for ulnar nerve or ulnar groove. So you can also be asked what structure relates to that part, which is the ulnar nerve. The ulnar nerve passes through the ulnar groove or groove for ulnar nerve. And then on the posterior aspect of the humerus, you have a groove called the radial groove. That's the part labeled 22, and it's for the passage of two structures, the radial nerve and the profundal brachial artery. The radial nerve and the profundal brachial artery. The part labeled 23 is the olecranon fossa. It's for the it articulates with the olecranon process of the ulna. So moving to this question now will help you to be able to recall some of the information. So the question says, what structure is related to the area painted blue? What structure is related to the area painted blue? So first of all, identify, is this the anterior surface of the scapula or the posterior, the medial, the lateral? So what are the things you can see on the anterior surface? You can see the coracoid process on the anterior surface. You can see the acromion on the anterior surface. So once you are seeing acromion, you are seeing the coracoid process. You know that's the anterior surface of the what? Of the scapula. And so this part painted blue is the subscapular fossa. So the question is, what structure is related to it? That's the subscapularis muscle. Subscapularis muscle. So it's the same question here also. So this is the humerus. So the part labeled green, the part painted green is called what? That's the olecranon fossa. The olecranon fossa. You can be asked what structure relates to it. The olecranon process is related to the what? Olecranon fossa. So here you have the question again. So moving to the forearm. We'll be talking about the forearm now. So the forearm is made up of two bones. The lateral bone is the radius and the medial bone is the ulna. Lateral bone is the radius and the medial bone is the ulna. So the part labeled 1 is the head of the radius, or you can say the radial head, and it articulates with the capitulum. The capitulum is on the lateral side of the humerus, is on the part where there's the greater tubercle is pointing to. The lesser tubercle is pointing anteriorly, the greater tubercle is pointing laterally, and then the head of the humerus is pointing what? Medially. So the structures you see on the side of the head of the humerus are medial structure, like the medial epicondyle, like the groove for the ulnar nerve, like the medial supracondylar ridge. All that are on the medial aspect of the humerus. So talking about the radius, the part labeled 4 is the radial tuberosity, and it's for the attachment of the bicep brachii. The bicep brachii is a structure that is related to the radial tuberosity. That's why the radial tuberosity can perform the function of supination of the forearm and also flexion of the elbow. The part labeled 3 is the neck of the radius, and you can be asked what structure relates to the neck of the radius. That's the annular ligament. The annular ligament help in forming that pivot joint in the in the proximal radioulna. So the radius can rotate within the annular ligaments. It can rotate within it. And the part labeled 6 is the anterior surface of the radius, the anterior surface of the radius, while the part labeled 9 is the posterior surface of the radius. The part labeled 10 is the ulnar notch. So the head of the radius is on the proximal side, the head of the ulna is on the distal aspect of the forearm. The head of the radius is on the proximal aspect of the forearm, while the head of the ulna is on the distal aspect of the forearm. So the head of the radius articulates with the radial notch, that's the part labeled 13 on the ulna, while the head of the ulna articulates with the ulnar notch of the radius, that's the part labeled 10. The part labeled 10 is the ulnar notch. The part labeled 13 is the radial notch on the ulna. So the part labeled 14 is the ulnar tuberosity, and the structure related to that is the brachialis muscle. Brachialis muscle. So the brachialis muscle attaches to the part labeled 14. And the part labeled 15, that's the head of the ulna. The part labeled 17 is the ulnar styloid process, the ulnar styloid process, and the part labeled 7 is the radial styloid process, the radial styloid process. The part labeled 18 is the posterior surface of the ulna, the posterior surface of the ulna, and the part labeled 19 is the olecranon process. The part labeled 19 is the olecranon process of the ulna. So the structure related to the olecranon process of the ulna is the tricep brachii muscle. The tricep brachii muscle is related to the part labeled 19, that's the olecranon process of the ulna. Let's attempt this question together. So the question says identify the area marked green. So the area marked green, that's the olecranon process that fits into the olecranon fossa of the humerus. So moving to the carpal bones. So we're talking about the carpal bones now. So here you have the image of the carpal bone. There are different mnemonics that can be used for the carpal bones. For example, she likes to play, try to catch her is one of the mnemonics. Some lovers strike positions they cannot handle is another mnemonics. And then she looks too pretty. She looks too pretty. Try to catch her is another mnemonic. So those are different mnemonics that can be used for the carpal bone. So it goes from medial to lateral and from proximal to distal. So if you look at this image, you see the scaphoid bone. Next to it you have the lunate, then next to it you have the tripetrum, next you have the pisiform, and next to it you have the trapezium. That's on this aspect, the most lateral on the distal aspect. Then medial to the trapezium, you have the trapezoid, and then next to it you have the capitate, and next you have the armate. So the hook of armate can actually be painted, and you can be asked what is the part painted. That's hook of armate, and the bone can be painted as armate. It's only the scaphoid bone and the trapezium that has tubercle. Only armate has hook. Please take note of that. So the scaphoid has the tubercle of scaphoid, and you can also see the tubercle of trapezium. So let's take it again. You have the scaphoid, that's the most lateral in the proximal aspect. Then you have lunate medial to it. Then you have tripetrum. Then you have pisiform. Then going distal, you have the trapezium, you have the trapezoid, you have the capitate, then you have the armate. So here you have the image again. So the path labeled 2 is this radial stylo process. The path labeled 2 is the radial stylo process, and then the path labeled 1, that's the radius. The path labeled 1 is the radius. The path labeled 3 is the scaphoid bone. The path labeled 4 is the capitate, and the path labeled 18 is the lunate bone. The path labeled 19 is the pisiform bone. The path labeled 20 is the tripetrum, and the path labeled 5 is tri- the trapezium, and the part label 6 is the trapezoid. The part label 21 is the armate, while the part label 22 is the hook of armate. So this view is from the palmar surface. Viewing it from the palmar surface, this is what you are going to see. But if you are viewing it from the dorsal surface, this is what you are going to see. So this is what you see from the dorsal aspect. So the part labeled 1 in this case is what is the radius. The part labeled 2 is the ulna. So the part labeled 15 is the scaphoid bone. The part labeled 16 is the trapezium. The part labeled 17 is the trapezoid, and the part labeled 18 is the metacarpal bone of the thumb. The part labeled 18 is the metacarpal bone of the thumb. So when you want to count, you count from the thumb side. Anything on the thumb side takes 1. So the first metacarpal is the metacarpal bone of the thumb. The second metacarpal is the metacarpal bone of the index finger, and like that. So you take it 2, 3, 4, 5, like that. So the metacarpal of the little finger is the fifth metacarpal. So the part labeled 4 is the lunate bone. The part labeled 5 is the trichotron. The part labeled 6 is the capitate, and the part labeled 7 is the armate. So on the dorsal aspect, you cannot see the hook of armate, but on the palmar view, you can see the hook of armate. So I hope we've gotten that. So yeah, let's move forward to the phalanges. So if you look at the phalanges, the part labeled 19 is the proximal phalange. So the part labeled 19 is the proximal phalange of the proximal phalange of the thumb. So the thumb only has proximal phalange, that's the part labeled 19, and 20 is the distal phalanx. So for the other fingers, they have proximal, middle, and distal. So 21 is proximal, is the 21 is proximal, then 23 is distal. 21 proximal, 22 is distal. sorry, 23 is distal. So 21 is the base of the proximal phalanx, while 22 is the head. So you need to take note of that. 21 is the base and 22 is the head of the proximal phalanx. So each of those phalanx like that, they have their head and they have their base. So the base is distal while the head is proximal. So thank you for listening. Please like, share, comment, subscribe. If you have any concern, any question, you can drop it in the comment section below. Thank you for watching this video. I know you've learned a lot. If there's any video you want us to make, you can drop in the comment section.